Hi, Dr. James. Listen, I just want to thank you for watching these videos. I hope they've been somewhat informative to you and not too long. We like to keep things brief and short because I know we all have a lot of busy stuff to do in our lives here. But you know that when you're in pain, boy, not a whole lot else matters to you. I myself, I've had disc herniations in my neck. I've had problems with my back, so I completely empathize and understand the frustration that you may have experienced in trying to get an answer for your pain. I've had to go through a lot myself to develop the answers and figure it out. And what I have really found, more often than not, is that it is a combination of things that need to get done in order for you to get a result. And that what often happens is this linear process where maybe you've tried the most conservative things in the world, like traditional chiropractic care, and it didn't work. That works for a lot of people. If it didn't, well, it didn't. And doing it over and over again for months on end isn't probably going to change that. Physical therapy for some people works, doesn't work for a lot of other people. So I'm assuming and imagining that if you're watching this, that you're probably one of those people where at least those two things haven't worked. Maybe you've had epidurals, or maybe you've had other types of injections and that hasn't worked for you. Maybe you've had surgery. Maybe you've had 2, 3, or even 4 surgeries. It's got to be frustrating when you're at that end of the other side of the table here, and you keep getting all these answers and nothing seems to be working out for you. So I want you to know that we care and we feel for you. Now, we can't help every single person who comes into the office. But as I said, you need a really thorough neurological exam. We need to figure out where the loss of function is, because that's really what helps us identify what tissues are actually causing the problem for you. And often they're different from where you experience the pain. You may have pain in your leg, but in fact the pain may be coming from your hip or your back. We see patients there are plenty of great doctors, but we see patients who get misdiagnosed a lot. And I empathize with you because I also hear that a lot of patients go into their doctor's office and it's kind of dismissed. It's like, oh, it's just a muscle spasm, here's some flexor, I'll take this and go, come back if it doesn't go away. And when you feel like a doctor's treated you like that, typically you don't go back to your doctor. And the problem for the doctor is he probably thinks that he did the right thing because you didn't come back. A lot of patients are told, get an MRI. They get an MRI, the doctor looks at the film up to the light and says, well, I'll get an epidural. If that doesn't work, we're going to have surgery. So I don't need to go through the statistics on surgery. I think you innately understand and know the risks associated with it, like infections and blood clots and hemorrhage and weakness and paralysis and dying under general anesthesia. All those things are real consequences of the surgery gone wrong. It may not be a high statistic that you die, but if it's you, the statistic's pretty pertinent. So really our goal here with all of our practitioners, and there are several of us here, our goal really is to get to the area of your nervous system, of your body, where you are losing function. Sometimes a back problem is caused by a neck problem. And sometimes a neck problem is even caused by a back problem. And then you have to dissect all those structures in the back that I've talked about. So, if you've been given a diagnosis of stenosis or sciatica, I can tell you that that's really a meaningless diagnosis because all that really is a description. Sciatica simply means you have pain down the back of your leg. Now, the sciatic nerve is actually made up of 5 nerves. Well, which one of those is affected? Or which combination of those things is affected? Or is that nerve, the sciatic nerve, being affected by your piriformis, which is a muscle in your buttock? So, it's kind of funny and sad, but if you go to your doctor and you say, I've got pain in my back and I've got pain down the back of my leg, and he writes you a prescription and says, you have sciatica, all he's done is given you a Latin term for what you told him you had. If your doctor tells you have stenosis, that simply means a narrowing down of the spinal canal. Well, is a disc bulge narrowing it down? Is a disc herniation narrowing it down? Is a facet joint arthropathy or hypertrophy narrowing it down? Are the ligaments that lay in between there called ligamentum flavum, are they narrowing it down? Are the vertebrae shifting back and forth? Is that narrowing it down? Are the bone spurs narrowing it down? Has the vertebra compressed and narrowed it down? Is there something called an epidural lipomatosis, an epidural like a fatty tumor sitting in there? Has that narrowed it down? Or do you have a combination of 1 or 3 or 5 or 6 of those things? So the combination can be endless, and that's important to us in treating you because what's causing it does determine what structures we need to treat and what needs to get handled in that case, or in your case. So I encourage you, if you're frustrated, we hear this all the time, make an appointment, come see us, because the only way to really determine if we can help you and if there is hope for you is to evaluate you properly. So we've already talked about in the last few videos what that would take and what that would look like, but a thorough neurological exam, a functional exam, a musculoskeletal exam, an orthopedic exam. This is not, folks, not just bending over and touching your toes and tapping your knee reflex and looking at an MRI, I can assure you that. There are very specific things that will get ordered in your case and that we need to look at. And then once we have all that information, we can certainly sit with you knee to knee and go over all the information from the exam and all the information from the MRI, and then we can tell you specifically what's going on with you, because the first aspect is an accurate diagnosis, and then from that accurate diagnosis, we can then tell you what your menu of options, if you will, would be in terms of treating you, and whether any of those things are treatable in our office, and if they are, here's your options, and if they're not, where do we refer you to, who's doing those things. So I encourage you to not give up on your spine. Too many people, I want you to be like Humphrey Bogart in that movie Casablanca, where he was right at the edge of the fog and then turned his boat around, and all he had to do was go another 12 feet and he would have been out of the fog. Don't be that person. Take a stand for yourself. We may be able to help you because we've been able to help a lot of people who haven't been helped before. So try to give us a call. 310-575-5575 is our phone number. 310-575-5575. And hopefully we can help you get to the bottom of your problem and eliminate your pain and get you back into your life and enjoying your life and your kids and your family and your sex life and your sports and your work, and get you back into contributing to the way that you want to in your life. Our job is not to keep you here forever. Our job is to determine what's going on, get you fixed, and get you out of here and get you into your life. All right, until next time, folks, have a great day.